Good evening, everyone. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Tonight's special guest that we have with us is Dr. Elizabeth Beatt, and she is a naturopathic doctor at Federal Way Naturopathy, located in Federal Way, Washington. And we are super grateful to have her here with us tonight, speaking on the wonderful topic of the natural approach to women's health and pelvic. Thank you so much, Dr. Beatt, for joining us.
Yes, thank you so much for having me. Can you hear me?
Yes, hear you loud and clear.
Okay, perfect. All right, spotlighted my video. So thank you for joining me. I'm going to go ahead and share my screen. Okay. Oh no, allow Zoom to share your screen. It's making me open some system preferences, allow the apps below. I honestly am really terrible with computers. Elizabeth, you have my PowerPoint also. I sent it to you.
Yes.
I did fix a couple typos, but no biggie. Maybe, would you be able to share your screen?
Of course, yes.
Great.
Yes, let me pull it up here real fast.
Thank you everyone for your patience. As Elizabeth said, my name is Dr. Elizabeth Beatt. We are in good Elizabeth company tonight. And I am the resident physician, naturopathic physician at Federal Way Naturopathy. And in my practice, I have a special focus on female reproductive health and integrative pelvic therapy. I did my ND training at Bastyr University, and I did a special certification program 6 months down in Portland, Oregon for my pelvic floor therapy certification. And I was trained by an ND, which was a pretty unique lens to be doing this work through, because it allows me to bring in all of the things that I learned in my naturopathic training, along with some of the pelvic floor stuff. And I think it's just a really unique approach to this work. Yeah.
Wonderful. Yay.
Yeah. And tonight you can kind of expect just an introduction to the anatomy of the pelvis and the pelvic floor. We'll go through some of the bones, the muscles. We'll describe some symptoms of pelvic dysfunction and introduce kind of the basics of and the indications for this integrative pelvic therapy. And I'll talk a little bit about what I mean by integrative. And that's kind of on the agenda.
Here, let me go here, and then I'm gonna share screen, and we are good to go.
All right, perfect.
Can you see that?
I can. It's kind of, there we go, from the beginning.
I think it's
All right.
taking a little bit to load. There it goes. And just tell me when to move the slide.
Perfect. The font is a little different, but I don't feel too attached to that. All right, everyone, again, welcome. So this is my talk, Integrative Pelvic Therapy, Healing the Root. I just introduced myself, and I just wanted to start the presentation with a picture, actually, that I was taken at my family's home in Pennsylvania. And the work that I do with this integrative pelvic therapy inherently does touch on themes of identity and belonging, family, home, safety, creativity, and our connection to self and others. And there's a chakra system in the Vedas that is becoming more popular in the last 30 years with sort of new age movements, but it's long known that there's an energy center at the base of the spine. And that is called the root chakra. And many of the pelvic floor muscles actually attach to the base of the spine. So this center and the themes that I just talked about, like the belonging and the creativity and the safety, Those are just themes that are very present in my work. And so I just wanted to start the presentation by welcoming that in. And next slide. Oh, thank you. All right, and let's just quickly orient ourselves to naturopathic medicine. We do have 6 principles of naturopathic medicine, and they guide my practice and the practice of other naturopaths who do this work. The first is do no harm. 2, the healing power of nature. 3, identify and treat the root cause. 4, doctor as teacher. 5, treating the whole person. And 6, prevention. So I just really want to emphasize the 3rd principle tonight because I think it so beautifully aligns with the work that I'm doing in healing the root, so to speak, through this integrative pelvic therapy. And in many ways, I believe that this pelvic floor therapy is a very pure and kind of true form of naturopathic medicine. And so I feel really passionate about it and lucky to have found this path and to be doing this work. Okay, next slide. Okay, the pelvis. Let's just orient ourselves to some anatomy now. So on the left, you'll see just the pelvis itself, which is made up of the sacrum, the coccyx, and then the hip bone, which itself has 3 different sort of zones. They're not technically separate parts of the bone, but it's those 3 structures. And then on the left here, we see that, on the right here, seeing some calls for mute. So on the right, you'll see that the pelvis is in relation to the top of the femur and to the base of the spine. So very quickly, we're already building some complexity around the pelvis. Next slide, please. All right, and so the complexity really builds quickly when we start to look at all the muscles that attach to the pelvis. And this is only capturing just a few, but there are very many. And they are really important to consider in integrative pelvic therapy, since any sort of tightness or weakness or injury to these muscles can really impact pelvic health and pelvic floor function. So we have the hip rotators. Some of these muscles are actually, the hip rotators are actually part of the pelvic floor, which is interesting, but they attach elsewhere as well. We have the hip flexors. In this picture, we have iliopsoas, which is one of our most powerful hip flexors, and which is a muscle that I frequently focus on in treatment. It can be quite tight. It does a lot of work for us, especially with our sedentary work. Many people working sedentary, just sitting in front of computers, TV, also driving, commuting. We're constantly using our foot on the gas and the brake. And it's also really deep in our abdomen, and it can be a place where we hold a lot of our tension because it's kind of protected. We have the hamstrings, which are on the back, and some adductors, many more, but I'm just emphasizing here that things get pretty complicated pretty quickly, and there's a lot of different factors that you need to consider. All right, next slide, please. And along with these muscles and many other muscles and connective tissue, I'm seeing the top is a little broken off, but it just says the pelvis also has its own muscles, ligaments, and tendons that create a sling between the pelvic bones. And that sling is really known as the pelvic floor. And the pelvic floor supports our abdominal and pelvic organs to help maintain continence and just like provide that support. It also works in conjunction with our abdominal and our hip musculature to maintain balance, which we just took a quick look at. And the pelvic floor coordinates with the diaphragm to maintain pressure in the abdomen. So it's kind of the diaphragm and the pelvic floor are kind of capping, and like capping at the top and the bottom are abdomen. And the pelvic floor essentially is forming the base, or again, the root of our core muscles. And so it's a really important, like committee of structures that work together to do a lot of things for us and to hold a lot of things in place. And then we'll go to the next slide. And here are just a couple muscles of the pelvic floor. There are actually 14 different pelvic floor muscles. And there's also connective tissue, ligaments, and all of the muscles and ligaments are organized into 3 layers. And so they're not all shown here, but this gives you sort of a general sense of the anatomy. And you can see how these muscles do in fact create that sling or that floor, so to speak, of our whole trunk. These muscles, again, are holding up our entire abdominal cavity, our digestive organs, our reproductive organs, our connective tissue, blood vessels, nerves, doing a lot for us. And I just want to take a moment to kind of appreciate the language here too, because we're talking about the trunk of our body being supported by the roots of our pelvic floor. And so to me, it seems like kind of an obvious tree metaphor. It's pretty strong. And just like the roots of a tree need to be healthy to support the trunk and the canopy, I believe very strongly that the pelvic floor and our root needs to be healthy to support our trunk and our limbs and just us in the world. Next slide, please. Just a quick reminder that we all have a pelvic floor. Whether you were born with a penis or a vagina, you have a pelvic floor. And there is some variation in muscles affecting the variation in anatomy, but for the most part, they are quite similar. And because we all have a pelvic floor, we can all experience pelvic floor dysfunction. So this is a very human, common, the manifestations of this type of dysfunction are very human and they're common. And if you've ever had them, I can say confidently that you're definitely not alone. Next slide, please. Okay, so what does it really mean when I say dysfunction? So sort of simply, we can think that like all muscles, those of the pelvic floor can become too tight or too weak, too loose. And they also are in a pretty close relationship to each other. And so one muscle's neighbor's tightness can cause some effects on the neighbor, and that could be too weak. There's often a lot of compensation. You have to think about, again, the muscles of the abdomen and the low back and the hips, and they might be compensating as well if there's weakness or tightness in the pelvic floor. And changes in this tone can occur for many reasons, including carrying a child, childbirth, whether that's vaginal or cesarean, hormonal changes, chronic urinary or bladder infections, vaginal infections, chronic digestive issues, physical trauma or emotional trauma as well. And these changes in tone can really create the dysfunction of the pelvic floor. And I just want to quickly highlight the digestive issues because we eliminate through our pelvic floor. Our bowels are coming out of our pelvic floor. And so those GI complaints or issues, diseases, concerns that you might have, there could very well be a component of pelvic floor dysfunction. And again, all of those organs are passing through the abdomen, supported by the pelvic floor, very closely related to some of those hip flexors. And so I actually do a lot of abdominal work with my integrative pelvic therapy as well. And that could be part of it or separate. And I'll come back to that in a little bit. Okay, so some common symptoms of pelvic floor dysfunction. There can be incontinence. There can be an organ prolapse, and that can be the rectum, that can be the bladder, that can be the uterus. Those are the 3 big ones. You can have pelvic pain with intercourse, chronic infections, any sort of sexual issues, lumbar or tailbone pain, and as well as just a general sense of disconnection with yourself or your root. And the next slide, please. So the indication. So this looks very similar to the slide before, but I've expanded to give some specific examples about possible diagnoses that people may have received or experiences that they're having with their body. So again, also postpartum recovery is a huge indication for pelvic floor therapy. In Europe, it's a part of all postpartum care, and it begins about 6 weeks postpartum. You really need to be done with bleeding to initiate the pelvic floor therapy. But it is just like a known and important part of the gynecological care that's received in different countries. And so I think it has a really important role, especially if you're having these symptoms of dysfunction. Again, incontinence, that's urinary or fecal. Pelvic organ prolapse, I just talked about that. It's the uterus, the bladder, or the rectum. Expanding now on pelvic pain, that can be vaginismus, which is essentially spasms of the vagina, creating a very tight opening that makes a lot of things painful, as you can imagine, whether that's intercourse or even using a tampon, for example. Pelvic pain can be because of interstitial cystitis, endometriosis, ovarian cysts, vulvodynia, which is essentially just vulvar pain, vulvar vestibulitis, which is irritation and inflammation of the vulva, painful periods, for example. Not on there is fibroids, sometimes even like surgical recovery. You can have hysterectomy and C-section, but even an appendix surgery or abdominal surgeries, those can really create adhesions a little bit higher up in the abdomen, but not that far from the pelvis. And that can kind of impact, again, all the neighbors that are in the area, whether that's muscles or connective tissue or organs. Chronic infections, it could be vaginal infections, urinary infections. One of the great things about pelvic floor therapy is that it really increases blood flow to the area and to the tissues, as well as helps drain and move the lymph tissues, which is the sort of adjacent system to our cardiovascular system, the lymphatic system, where all the white blood cells and immune cells are moving, and they get filtered in kind of a separate highway. But they are very responsive to manual therapy, and it can help bring immune cells and clear out waste. Again, indication pain with intercourse, whether upon entry or deeper pain, sexual issues. Again, the lumbar tailbone pain, whether that's after falling on your tailbone, or you don't even know that you have a coccyx that is a little anteriorly tilted, and that's impacting the structure of the muscles. There's many different ways for having that type of pain. And then indication would be a desire for that connection to your root or yourself. Great. Okay, so what is integrative pelvic therapy? So the root of the word integrate actually means to make whole. And for me, I think that's that is really my goal that I have in mind with my patients when I do this work with them. I really want to support them in feeling healed and in feeling whole. And I happen to be doing that with pelvic floor therapy. And so what a visit looks like really is there's a assessment. So we do a whole intake. I hear your story. I get to know you and get to know your concerns and your history, and it's all welcome. And we'll just get to know each other, and then there will be a hands-on assessment to your comfort, and consent is always a huge part of the process. The manual therapy can include intervaginal or interrectal work, but it does not have to. A lot of these muscles can be accessed from outside of the pelvis, basically. And so it's always to patient readiness and desire. And so the manual therapy, it's really soft tissue massage, myofascial release, stretching, mobilization, and I do a lot of cupping therapy. And that's to the pelvic floor, the abdomen, the uterus, which can be manipulated from the outside, hips, sacrum. And so that's really the scope of the hands-on part of it. And then I really love supporting and exploring the mental emotional factors. Through my certification in pelvic floor therapy, and also through some mentorships with the same ND who taught that, I have training in somatic dialogue and counseling, which is really tuning into sensations in the body and identifying, what's a little bit deeper to the sensations. What is there an emotion there? Can we identify that emotion? Can we kind of figure out what that emotion needs, and then kind of do some exploration around that. And I love that piece of the work. And I think it's really important, again, because that the root of our body brings up all of these themes of, again, family and belonging and creativity and safety. And I think that it's a really charged part of our bodies. Herbal medicine is a huge part of my practice. I had a passion for that in school, and I continue to have a passion for that. I really love using tinctures and teas. I do love tasting the herbs. One of the great things about tinctures is, even teas, it's a little bit harder because it's hard to find bulk herbs, but tinctures, you can really make specific formulas for the individual person. And oftentimes we'll use herbs that are have an action called nervine action, which is basically relaxing, antispasmodic if any of your muscles are tight. Some like carminatives, which is just a fancy word for like helping with digestive spasms. You name it, there's a lot of different ways to bring herbal medicine into this practice. And you can also do smaller drop doses of herbs and really sort of tap into the lessons they have on that more mental, emotional level. There's also targeted supplementation. Sometimes the supplements are herbal formulas encapsulated, or it's nutrients and vitamins and minerals to help strengthen the ligaments, or keep people regular, you name it. There's a lot of different things we can do. And then patient education is always a huge part of this integrative pelvic therapy. And that goes back to the principle of doctor as teacher. Also, just really getting to educate people about their bodies and their symptoms, and sort of demystifying symptoms and demystifying any sort of experiences by sharing information and providing tools to help them really participate in their own healing. And then, although annual exams are not really, they don't have to be part of this integrative pelvic therapy, and they're not like part of the series that I really offer. Annual exams give you the opportunity to really check in, and you get a head to toe, and you discuss like the whole person. And then also there's pap smears, colonoscopies, prostate exams, things that people don't love, but those are all important screening to do for people at certain ages, to make sure that we're not missing anything, and that if anything comes up, that we can really address it in a timely manner. So I just wanted to throw out the annual exams. Luckily in Washington, naturopaths are licensed as primary care physicians and can do annual exams. And so I think that those exams offer really good time to talk about, sorry, I'm just getting distracted by a question, any concerns that you have, and to get the screenings that you are eligible for. All right. I think that's the last slide. Again, just wanted to say thank you. I'm Dr. Beatt. I work at Federal Way Naturopathy. Let's see, naturopathic medicine. So these are kind of this is what I focus on. Naturopathic medicine. Again, that is my primary training. That is the lens that I use and that I look through when I do this pelvic floor therapy. And because I'm a doctor, I have all of this extra training in herbal medicine and counseling and nutrient and diet therapy and supplementation, and treating the whole person, mind, body, spirit. And so I think that the pelvic floor therapy that I offer has a little bit of a unique set of tools that I can use, essentially. And then there's that integrative pelvic therapy. Part of that is the abdominal massage, but I also do just the abdominal massage for patients, botanical medicine, and the somatic counseling. So those are really my passions, my areas of focus and specialty. And I'm accepting new patients. I'm available to anyone. I do have certain contracts with certain insurances, but that's a conversation for another day. And tonight was really just focused on introducing this work that I'm so passionate about. So thank you all for joining.
Thank you so much, Dr. Beatt. That was wonderful.
Yeah.
I'm going to stop the screen share here and open up to questions. We'll get you on the spotlight. There we go.
Okay. Okay. So I see a question. Oh, what type of doctors would I look for as a primary care physician who offers similar care? What are they called? ND. Yes. Yes. So it's naturopathic doctor in Washington State. At Federal Way, we have 7 practitioners, and we all do naturopathic primary care. And then everyone sort of has the area of focus beyond that. What are the other acronyms? It's just ND. Yeah. So check it out. There's also, it's actually a really great state to practice naturopathic medicine in. There's a lot of naturopaths in the area. Yeah, thank you. Elizabeth has just shared our clinic's website. So you can go on there, take a look around. There's a whole About Us page, and you can read about myself and the other providers. We're located in Federal Way, kind of right off of Pacific Highway. I'm not super familiar with the area, but I live up in Seattle. Do you teach exercises to strengthen your pelvic floor? Yes. Yeah, that's part of the education. A famous exercise is a Kegel, but you always have to use a Kegel with caution because, like I said, if there is weakness in one area and tightness in another area, you don't want to start a Kegel because you are actually going to exacerbate that imbalance. And so part of the pelvic floor work is establishing a balance and before progressing into strengthening, if that's what is indicated for you, or balancing and continuing to relax the muscles if they're a little too tight. So stretching also goes to some of the hip flexors and the muscles of the hips and the hamstrings as well.
Beautiful. Thank you.
Yeah.
Any more questions, folks? I'm going to check Facebook Live here. All right, no questions on there. Oh, yes.
Nerving. Oh, nervine. Nervin. That is a class of herbs, and it is essentially a umbrella term for herbal medicines, lavender, lemon balm, chamomile. Those are kind of famous ones that I'm sure you've heard of that are oat that have action on the nervous system, and they can be relaxing. They tend to be relaxing. They can be sort of tonifying and restore sort of nervous exhaustion. Each herb has a little bit of a different indication and a little bit of a different action and a little bit of a different sort of energy kind of based on where it grows and the type of the water it needs, etc. So it's nervine. I'll type it in for you all. And that is specifically, it's not a therapy, it is a class of herbal medicine, or it's a action, so to speak.
And that's a great way to remember that it what it all does, because it's in the root word of it.
Yeah, exactly. Nerve.
Yeah.
Yeah.
Well, any more questions, folks? Well, we're going to say goodbye to our Facebook Live friends. We super duper appreciate you tuning in. definitely follow up with Dr. Beatt at the a link that I posted in the comment section, and definitely take good care and have a happy spring.
Thanks, everyone.